said before, but actually I'm a dentist. So, yeah, so this is for specific. Alright, so the prevalence of dental erosion among Brazilian adolescents with symptoms of eating disorders. So, again, as we see, adolescents are faced with many changes a person is passing through. So, some of them make lots of things to, for example, connecting with the body. They do some things like throwing out to not have the calories they have just ingested. Or they pass too much time without eating anything. So, these kind of habits affects directly on the tooth health. Alright? So, the acid content of the stomach and also too much time without eating anything makes the pH of mouth acid. And all of this inflicts damage to the dental tissue. So, as we see, and it's said by many studies, the dentist is one of the first professionals of health that may identify the possibility of an eating disorder in a patient. So, as we can see here, well, I don't know if it's really clear, but we can classify the dental erosion on some levels. This is the first level that affects only the enamel, the most external tissue of the tooth. This one, the second level, we can see also the dentin. You can see it's yellow, more yellow in the center. A third level, where it can affect the dental pulp, alright, not directly because there are some cells that make defense mechanisms that do not let the dental pulp to be affected directly. And also, but unfortunately less common, we can see dental restorations to prevent pain in these adolescents. First of all, they do not look for this kind of treatment, and it's not effective alone. They look first for desensibilizing toothpastes, thinking that it's enough for their treatment. So, by this, the objective of this research was to determine prevalence of dental erosions among adolescents. Students from public schools also received with symptoms of eating disorders. Well, the population I consider here was from 12 to 16, and this research was done in 2006, actually in 2007, but it was, the ethics committee was approved in this year, and as we can compare as the last presentation, the expected proportion for the sample calculation was 17.4%. This is data from 2004. The last one we had was from 2010, was 33.3%. So it was higher. So in the end, the sample was composed by 650 students. We used the eating attitude test in the adolescents version, the bulimic investigatory test of Vandenberg, and we had some methods of collection of data. First of all, when we went to the school, before the examinations were done, we made a kind of calibration, a theoretical and practical calibration to make a standardized pattern of examination. So, in the pilot study, we took 100 adolescents, and we could make it through. We saw some theoretical presentations about the issue, and then we had a protocol, a pattern protocol for the examination. We could use natural light with artificial light, sit in front of the patient, and they should brush their teeth before the examination to avoid any kind of things that can compromise the examination. And also, this study was together with an extension project that can be seen in one of the posters there called Petra. That was an extension project of eating disorders in these patients. And we explained, we gave some kind of presentations to them to explain some things and take off their doubts. We made a pilot study with 100 adolescents. And also this study was approved by the Research Ethics Committee of our university. The sample was about half from male and female, and the proportion of the age was almost the same of each age. And dividing the distribution of the same, but the presence of eating disorders, we found out that 33.1% was positive with the EAT instrument, and with the BITE instrument, 36.5% had a medium score, 1.7 had a higher score. So, as you can see in the table, for the one that had dental erosion, we found 50.7% with the EAT instrument, making it significantly, statistically significant. Also, when we look for the presence or not of erosion and the face of the tooth that was affected by the erosion, we also found a statistically significant difference. Oops, sorry. And about the BITE instrument, we also find difference with the presence of dental erosion. 59.3% of the positive symptoms of bulimia had dental erosion. Alright, and also, considering the face that was affected, we found significant difference also. So, after analyzing the data, it can be concluded that the presence of oral diseases, such as dental erosions, which are considered irreversible damage, can assist the early detection of subclinical before installation of the complete syndrome. And some authors consider the amendment as the first clinical sign of the disease. So, knowledge of these changes on the part of the dentist allow the routing of team full treatment, which involves the participation of multidisciplinary team. So, it's not only the dental restoration that's going to help to prevent this kind of disease and help finish the symptoms the patient may feel, but a multidisciplinary team to intervene in that patient. Okay? And this is my university. Feel free to visit us whenever you want.
Very good.
That was great. Yes, a question here, please.
I did a survey of dentists in Gloucestershire in the UK, and there were very low levels of kind of confidence about dealing with eating disorders, relatively low levels of knowledge, and so even the ones who were picking up the signs of dental erosion specific to bulimia were not actually doing anything about it, so they were not informing GPs or discussing it with the patient at all. So I wondered, I mean, for me, the implications of that were to do some work with dentists around that, but unfortunately I've never had a chance to, never been quiet enough to do that. But do you have plans, or do you have anything in place at the moment to actually help dentists to be able to refer people or to deal with what the signs that they spot?
Well, I think the best form that we have to show other people some good thing to be done is doing it yourself. So actually, I'm in my state in Brazil. Nowadays I'm the only one that's working with dental erosion and eating disorders. I'm doing a research now with an epidemiological study with this classification of dental erosion to try to identify the association between the presence of an eating disorder and the dental erosion. So also we work with extension projects with eating disorders too, and we try to show it not only the students, but also their parents, the teachers of the schools we're working. And I think the best way that we have to show them how they can manage these patients is through publications and going to some kind of governmental campaigns to show the importance of it.
Could I just come back to that? Yeah, I understand your logic. I don't think that actually publications make a difference to people's behaviour, as the whole discussion yesterday was showing. And in terms of what I said about, my experience with dentists was that they wanted to help, but they didn't know what to do. So I actually had a very simple idea, which again I've never been able to put into practice, but it's just for them to have a leaflet and to be able to say to the patient, your teeth show damage from acid erosion, maybe several causes of acid erosion. One of them might be self-induced vomiting. If you're worried about it, here's a number you can ring. You just give it to them, as simple as that.
Actually, I attended a patient some time ago, and I found she was with dental erosion. I asked her, do you used to throw out? She said no. Her mother was with me, was with us at the same time.
Yeah.
And then I asked her, do you spend too much time without eating anything? She said no. Her mother, yes, she spends.
Yeah.
So there's a problem of the non-identification by the adolescent. But I talked to her mother in private to say, well, I'm not saying she has it, but she may have an eating disorder because she presents this kind of condition and this kind of habit. Pay attention to it, and you maybe take her to a psychologist or psychiatrist to make more investigation.
Questions? Yes.
Sure.
Did you say is it completely irreversible, this damage?
Yeah, because the dental tissue was done only once.
Oh.
I mean, in the permanent dents. So once you lose it, no way to take it reversible. You can make dental restorations, but if you treat a condition like this I showed, and there is no treatment in an eating disorder or eating behavior, it's going to be useless because the remaining dental tissue will continue to be affected by the acid. So it's going to be lost.
So is that in itself, I mean, just sort of thinking about working with actual patients, I think when I talk to my patients about things that are, like for instance, osteoporosis and this sort of thing, I think people need to have that information, don't they, that actually what they're doing. It can be really motivational, actually really frightening for people to think, oh my God, I could lose my teeth.
Yeah.
That sort of information I think people need to have,
Sure.
don't they?
Sure.
It's been my experience that it isn't incredibly motivational to tell people of the dreadful things that will happen to them, but it can be motivational to the parents to make sure that they actually seek help for this condition. I'm intrigued by this information, maybe everybody had it, but I didn't have it, that alone, going for long periods of time without eating, in other words, restricting, causes an acid environment. To what extent does that result in erosion?
Well, as we know, or not, the dental erosion is a chronic development of the disease. So patients who spend too much time without eating constantly, the pH of the mouth gets acid. Yeah, it's low. So it also affects the dental tissue.
So you can actually see that, do you think? If all a person was doing was restricting severely, would you see it reflected in the teeth?
Yeah, it can be seen by the habits of the patient.
That's good information for parents, I think. Any other questions or comments? Either for this speaker or for any of the speakers? Yes.
Oh, sorry. I was just interested in your view. It's completely separate, but there's quite a large opposition, I think, between the eating disorders world and the dental world, where in the dental world they always say don't snack between meals, and in the eating disorders world we say snack between meals. How do you resolve that conflict in your practice and those discussions with the eating disorder professionals?
Well, as we know, there are other ways that, other habits that may compromise the dental structure, the dental tissue, like brushing too much time in the teeth is one of the things that may compromise the dental structure. So I think that these snacks between meals, if it's sugar-free, it's better, because the need for brushing the teeth is, I can say it's lower, because we don't need to brush the teeth every time we eat something. But if it's sugar-free, it's better. And this kind of habit may put the acid content not too acid.
Well, there's the conflict.
Yes, exactly. I think by design it's not going to be sugar-free, right? Yeah.
Thank you.
Okay.
Great. Anything else? Anybody would like to ask any of the other speakers? No. Well, thank you very much to all the speakers and those who came.
Rodrigo, tira uma foto com ela. Rodrigo, tira uma foto com ela. Pede ela para tirar uma foto. Very good, né? Então, filmei o tempo todo.
Ótimo.